Yeah. How much of a concern is the medical supply shortage?
So it's a really big concern. Our supplies are running short. We've had a really hard time, just as a private medical clinic, getting supplies that we would normally order in the routine course of doing business and taking care of people: gloves, N95 masks, hospital gowns, any personal protective equipment, alcohol wipes, sanitizers. It's very difficult for hospitals and medical clinics to come by these even through our normal channels and supply chain that we would use. So this is having a big impact on us and certainly on the hospitals as well. And so what we're asking is, if you have purchased, for the general public, if you've purchased any of these things and you're stockpiling them at home, consider donating them to your hospital right now.
How much of it? Well, first of all, where do you get them? Do you guys have you don't go to Amazon, right? You have like a medical supply.
We have a medical supply company we use called McKesson, and they've been really great to work with, but their inventory is dwindled down to almost nothing on a lot of these supplies. We've tried Amazon, when we can't find it through there, and obviously everyone knows there's nothing on Amazon anymore either in terms of that stuff. So again, if you have a large quantity of any of these needed medical supplies like gloves, alcohol wipes, N95 masks, hospital gowns, goggles, please donate them to your hospital right now.
Why masks? Why are they so important to have the masks?
The masks are important for the healthcare workers. The general public does not need the masks unless you are sick and you have COVID-19 to prevent you from spreading it to others. But because healthcare workers are going to be in such close proximity to known infected and potentially exposed people, we want to go above and beyond to protect their health as much as possible. Because if the healthcare workers become sick and quarantined, then we have a much bigger problem on our hands.
And we've heard a lot about the ventilators. Is that something you use, or is that only like for critical care?
That's for critical care. Those are essentially breathing machines that you see in an ICU setting, and certainly we have a limited number of those in San Diego County, and in this country. But I think, first things first, getting basic supplies out there and back into the hands of the people who need them and can use them is the most important thing.
Oh, and you did say, you kind of answered this, what, if anything, can the general public do to alleviate the shortage?
If you have supplies, bring them to your hospital. You can just, I don't know what the policy is for each hospital. Try not to have any social interaction while you're doing it. And then, the best that we can all do is to stay home, to self-isolate, and wash our hands at every opportunity, wash off your phones, and really everyone has to do their part at this point. The sooner everyone can comply with these public health requests, the sooner our lives can get back to normal, which will happen eventually.
You think, really?
Yes.
That's all she asked me to ask. I heard you guys are kind of just doing
Yeah, so we're only doing, yes, so we already are set up to do that, and we've been doing that for a while for our existing patients. But we have now expanded that to offer more telemedicine and virtual health visits for everyone in our community that's interested. We also do health coaching to help with stress management and anxiety. So we're really here for everyone who needs our help at this time, and we want to do whatever we can to get good information out there and to help serve the public. We also have a YouTube channel and a podcast every day where we're posting new information about COVID-19. It's Kind Health Group YouTube and Kind Health Group podcast.
Okay. Have you ever seen a shortage this crazy?
No, I've never seen anything like this. But none of us have in healthcare. This is unprecedented for everyone.
And as far as masks, gloves, I guess just donate it.
Donate if you can. You won't need any of those things if you're staying home. So that's really the main message.
Do you think all the people that wear them all the time are just kind of doing it for no reason?
I just think they may be getting incorrect information out there. you know, really it's all about hand washing, keeping your distance, avoiding unnecessary exposures at this point. A mask isn't going to protect the general public. It's really designed for people who are already sick and healthcare workers who are in extremely close contact with very sick people.
I read an article that said like they're just saying that there's a supply shortage. That's how.
No, it's real.
It's real. Like it really does nothing.
It really does nothing. I mean, there's lots of studies and evidence-based medicine behind that.
Okay,
So
that's good.
yeah, we're not just making it up because we want to.
That was the article I read. That's not my personal opinion.
Yeah.
Let's see. I think that's it. Anything else I should know that you want to get out there?
I think that's it. Everyone, I say this every day, but we need to try to remain calm. I know it's okay to freak out every once in a while. I've certainly done it, but know that we are going to come out on the other side of this, and you know, this is the new normal for a little bit, but it'll get better eventually. So, and you know, we want to protect our vulnerable populations right now. We have to keep in mind that most of us who are healthy, I've had a lot of people ask me, well, is this an overreaction? And the people who are asking me that are the healthy people, obviously. So it may seem like an overreaction to people who are healthy and young and won't be as affected, but the idea is to really protect our most vulnerable populations, the people over 65, people with chronic medical conditions who have the potential to have very serious and life-threatening complications from this. So we're doing this for them, and it's really important we all come together right now. If you have a neighbor or somebody you know, an elderly friend who has a hard time, will have a hard time getting out or needs help, please reach out to them. It's important that we think of others in this time, not just ourselves, and really come together as a community and as a nation.
Cool. I think that's it. Can you think of anything else? Are all your questions answered too?
Yes.
I think so.
Okay, thank you very much.
You're welcome.